The Georgetown Public Hospital Corporation Accident and Emergency Unit treats between 60,000 and 80,000 patients annually. For the first half of 2016, the country's largest healthcare facility has recorded almost 1,000 patients seeking medical attention related to road accidents, and already the hospital is projecting that number to double by the end of the year. Dr. Zulfikar Box is Ghana's lone emergency medical specialist. He heads the Accident and Emergency Unit of the GPHC. Dr. Box feels persons should try to avoid accidents at all costs, since accidents come with a string of consequences. Any more than 8 critically injured at a given time at the hospital puts a strain on the system.
We've had quite a few mass casualties with motor vehicle accidents, and I must say it has been a tremendous stress on the emergency room, because what happens is that we have to divert our resources to those cases, and unfortunately other patients that are waiting for care, their time of waiting is increased.
Then there's alcohol consumption, listed among the major contributory factors to road accidents, according to Dr. Box.
On an average, about 80 to 85% of the cases that come with motor vehicle accident is either the person is intoxicated that's injured, or the person that was injured was because of an intoxicated driver. So, and that's what I keep saying, is that the cost on the system, the burden on the resources, it goes back to negligent drivers for the most part, but also has to do with drivers who are actually intoxicated.
While injured females do visit the ER under the influence of alcohol, young males under the influence of alcohol dominate the ER visits, and whenever they do, in most cases, medical professionals are challenged.
Guys that are actually intoxicated, that comes in here and behaves aggressive and make it very difficult to us to instant stabilize a fracture for them, because they're punching you, they're vomiting, throwing things all over the place, cursing, and it takes away more staff to actually help to calm down that person so you can do the intervention.
As far as road accidents are concerned, the Minister of Public Health could not estimate the average cost per patient to the state's healthcare system.
Really would be amazing to know the amount of money that is going in that direction. But it all boils down to that big whole concept of health financing. Our approach has got to be different.
He made reference to the fact that when one becomes permanently disabled through an accident, there is an adverse effect on the person and family. Take the case of 13-year-old Shamar Henry. He is bedridden since May 29 last. He was hit by a speeding car on a Good Fortune public road on the west bank of Demerara. His mother, the breadwinner of the family, spends most of her time providing around-the-clock attention for him. Handel Duncan, HGP Nightly News.